Hi, everyone. I'm Courtney with Youngtimers. I'm our program manager, and I'm so excited to have Mike Zuendel with us today. He is going to be sharing his experience with us about living with early onset Alzheimer's disease. He's here to share his story openly and honestly, which we are so grateful for. We're going to spend most of our time in a conversation, and he's going to talk about what it actually feels like to live with early onset, as well as what happens when the treatment starts to work. So, thank you again, Mike, for joining us. Would you like to take a few minutes to introduce yourself and tell the community who you are?
Sure. Yeah. First, thanks a lot, Courtney. I really appreciate the opportunity to speak to this great group. I've heard about Young Timers for quite some time, and so I'm really anxious to, share a conversation. Right now, I'm in Des Moines, Iowa, where I have a business family. My background is both of my parents had Alzheimer's and passed away from Alzheimer's disease, and I was their caretaker. And from that, I developed a sense of heightened awareness of Alzheimer's disease. And so I'm involved in various groups. I was in the Alzheimer's Association early stage advisory group. I'm a consultant to some companies that are in the pharma area and the digital biomarker space. And so I'm a curious person by nature. So over the last 6 years, I've spent a lot of time doing some deep research, and I've had the luck to be able to hook up with some of the leading researchers in the United States and in Europe. And so for a non-professional, I feel I'm a pretty good grasp of what's going on in the current field, but just really glad to be here. And thank you everybody for showing up to have join this conversation.
Thank you so much. Yeah, you definitely made a name for yourself in the community, that's for sure. So, if you don't mind, I'd love to start kind of at the beginning. When did you first start feeling like something maybe was a little bit off or something was changing? And then what was your path like to getting answers?
So in the beginning, as I mentioned, both of my parents had Alzheimer's disease and I was their caretaker. So obviously I was kind of concerned about myself, you know. My mom's path and my father's path were sort of completely different. My dad played football at the University of Notre Dame in the era of leather helmets. And so I think he may have had some traumatic brain injury that maybe contributed to some of his cognitive issues. His course was a little more difficult than my mom's. My mother had a more benign course. So I was very aware of that and concerned about my own self, obviously. So I took a 23andMe test and discovered that I had both APOE4 genes. And so that got me more aware. But I was becoming concerned about my own memory and thinking issues. And so, we all have turning points in our life. And turning point for me was nothing all that remarkable. But one day I was walking around my house trying to find my phone, which was becoming, quite frequently. I couldn't find my phone. And I live in a home that's on 5 different levels. And so I went downstairs to the garage thinking I left it in the car. It wasn't in the car. Went back upstairs to my bedroom. No, it wasn't in the bedroom. Went back downstairs to my office. It wasn't in the office. Went in the kitchen. Wasn't in the kitchen. Went back upstairs again. Couldn't find it. So I asked my wife, I said, "Hey, Brooks, could you just dial my phone so I can hear it ring?" Okay. So my phone did ring quite loudly. I had been holding my phone in my hand the whole entire time. So that's when I said to myself, okay, I better find out what's going on here. So I did a lot of research on where could I go get treated. Okay. My doctors that I was going to told me one, nothing to do but eat kale, which is good advice, but not really real thorough. I tried to get into Mayo Clinic, but they didn't accept me. And that took about, 3 months just waiting for them to give me yes or no. I finally got into a place in Phoenix called the Banner Alzheimer's Institute. And it's a top research center. They also have a small portion of their mission is to treat patients. And I was lucky enough to get treated there. So that was sort of the course of how um, I found out. Looking back, I could have been diagnosed 5 years earlier. I got diagnosed when I was 65. And looking back, I probably had 5 years of wanting to be diagnosed, but I was afraid to get diagnosed because I've had depression in my life. And I always thought that maybe if I got diagnosed, I would go down that rabbit hole again. And I did not want to do that. And there's also just a fear based in stigma that what's life going to be like after I get diagnosed. So that was sort of my lead into that.
I appreciate you sharing that. I do want to clarify for a community that Mike mentioned the ApoE4 genetic component to his risk factors, and we all know in the community that we have those genetic determining factors. Unfortunately, we don't have the risk factors as much. So we have the genetic mutations on PSEN1, PSEN2, and APP that are very deterministic. However, they are early onset as well as yours. So that's why we wanted to welcome you to the community to talk about your experience. You also mentioned the stigma and the fear. Those are all things that we all carry with us every day as well. Seeing your parents go through it, they're all very similar experiences. So I really appreciate you sharing that with us. And that leads me into wanting to know a little bit more about the emotional toll. It probably led to a little bit of an emotional heaviness with that uncertainty leading up to your diagnosis.
Yeah, well, so I went to Banner, and first thing I did is I got an appointment, and they diagnosed me with memory loss. Okay. And they wanted me to come back for a more complete exam. I went through the 3.5 hour neuropsych exam and beta amyloid PET scan. And so went back home to Des Moines and waited for the results. And I was alone at the time. And I got the results in my patient portal. And the 3.5 hour neuropsych exam said the results of that were consistent with mild cognitive impairment due to Alzheimer's disease. The results of the beta amyloid PET scan said I had a pathological buildup of beta amyloid plaque throughout my brain with some areas of complete obliteration of the gray white matter. So I then had officially been diagnosed with mild cognitive impairment due to Alzheimer's disease. It wasn't unexpected, but when you get a diagnosis like that, it hit me like a ton of bricks. And it's just kind of hard to describe. Your thoughts go to some of your worst fears and visions. One vision I remember of my father having two black eyes because he couldn't remember to get out of the way when he opened up his bathroom door. So it was kind of devastating, but I had a great support family. And we all got together and decided, okay, what am I going to do with the diagnosis? And I wanted to go public, okay, because I didn't want to have to hide it. I didn't want to have to, have people wonder what's wrong with Mike, Also, I wanted to go public to fight the stigma. But I was also afraid to go public because of the stigma. And so we're having this talk, and my daughter said, Dad, if you don't do this, who will? So you're not going to disappoint your daughter. So that was sort of my decision made. But it was a tough weekend. I will tell you that after a lot of tears. But I decided that weekend, I told my family, I said, I'm not going to let this disease beat me. I'm not going to let this disease define me, change me, or push me into a corner. That was, 6 years old. Don't know how. I don't know what. But I'm just going to fight it and do everything I can and not let it try and control my life.
That's really awesome. Thank you for sharing that. That's really important. And I think everyone can really appreciate and recognize a lot of those feelings and about sharing versus keeping it to yourself and how that affects not just you, but your family as well. So, has there been any significant changes that you've made in your life, both practically, personally, since your diagnosis?
Yeah, and I'd like to say nothing has changed and everything has changed. Nothing has changed because I'm still active. I run a business that's about to double in size. I drive off-road race cars in the woods, and I still do that. I'm busier than I've ever been in my business and in the initiative that I started. And so I'm busier than ever, and I'm loving it. So that's not changed. But what has changed was some advice that I got from my geriatrician on the day she diagnosed me. She said, Mike, I know this is a tough day for you, but I just want you to hang on to one thing. You can find gratitude if you just look for it. And you're going to get through this by embracing gratitude. I went home and thought about that. And it really had a big impact on me that gratitude is something that I can't lose hold of. And if I started practicing gratitude, not only giving gratitude, being kind to people, saying thank you to the person at the grocery store, how's your day going? And, they look at you because no one talks to them. You made their day. And just being thankful and grateful for all these little things. And also finding gratitude in my family, my everyday life, giving gratitude. I mean, there are studies that show when someone smiles at you or you smile at them or you give people gratitude, you actually have biochemical changes in your brain that they can measure that induces a feeling of calmness, of clarity. So it's not just put your rose-colored glasses on and be happy. It actually has a physical effect on you, okay? I look at it that I'm gonna be the first survivor of this disease. The only thing better would be to be 1 millionth and first survivor of this disease, but I'm not giving up because I can't. That's just sort of the way I'm wired.
Yeah. That's really great. The gratitude piece is really wonderful. I'm glad you shared that with us. I think we all can take a little lesson from that. That's for sure.
It's important. It's really worked for me quite a bit, because I'm kind of a person who likes to find fault. I used to be very judgmental. It's just this is a much better way, and I feel better. I feel great.
That's wonderful. So you talked about staying active. You talked about being social with your family and your business, and you talked about gratitude. And I think that we would love to hear more about your medical treatment now.
I wanted to find a treatment. I did a lot of research, and I wanted to get into a center of excellence. As I said, didn't really find anybody locally. I went to one doctor who was an internal specialist, and I talked to him about my issues, and he said, "Well, what you need is a major research center. Is there anything else I can do for you today?" How about getting me into a major research center? So that was like, thanks. So I got online and I said, well, Mayo is sort of a good reputation. I spent a lot of time trying to get into Mayo, and they finally said, no, your cognitive issues aren't severe enough. And so I finally found Banner. So I got into Banner. And when I first got there, there was no treatment available. But about 6 months after I was there, Aduhelm became available. Now, they at their center would not give me the medication, but my doctor could write an order and I could go to a commercial infusion center and get it because I'm sort of kryptonite. I have both APOE4 and they're really afraid of me. I made that decision. And when it came out, I insisted that I get placed on this. And there was a lot of, you got both APOE4, there's all these side effects. And I think a lot of attorneys were involved in that decision, and their care committee was involved in that decision. They finally said, well, we'll let your doctor write an order, but we're not going to do it inside our hospital. So I started my infusions. But during that journey of trying to get treatment, the side effects always came up. And when the drug first came out, all they could talk about was side effects, the side effects, the side effects, the side effects. And doing a lot of research in that, when the major studies had 3 people in the treatment group pass away. But they didn't tell you in the placebo group who were getting the sugar pill or the sugar juice, 4 people passed away. The side effects, they would always say bleeding and swelling of the brain. They made it sound like the blood was going to come gushing out of your ears. The side effects, 90% of the time, were called ARIA. It's only found on a PET scan image, and it's about the size of a tiny period, at the end of a sentence. And it's called a microhemorrhage. And there's no symptoms of that, but they were finding people getting some microhemorrhages, and they stopped them on the drug, and they all got better, and some actually went back on treatment, okay, and some not. So my position with them was, listen, there's no drug out there that doesn't have side effects, not a single one. Uh, and some are really severe side effects. So my point of view on that was, okay, tell me all I need to know about the possible side effects that are rare of this drug. Okay. And then tell me about the side effects that are 100% certain of Alzheimer's disease. And let me make that decision. And that was an easy decision for me to make. I'll take the drug right now because I know if I don't, what's going to happen. Now, that's just me. I'm one person with my own brain and my own feelings. I was willing to take the risk. I didn't really believe it was that much of a risk. And the alternative was wait. I like to tell people when I give some speeches, I said, my clock is ticking, and every day the ticking gets a little bit louder. So I have a sense of urgency to get to fight this disease in any way that I can. So that was just sort of my journey on the medication. It's very interesting. The cost of it is a big factor. I've never been in a study, so this is all on my own and being proactive, which I could talk an hour on how you must be proactive with your own health. And you can't wait for the doctor to call you and tell you what to do. You got to get as knowledgeable as you can. Go to Dr. Google as much as you can. Go in there prepared. And if they're not giving you the right answers, find somebody else. I just feel very strongly that our healthcare system is a little bit broken, and it's up to you as a patient or someone who had living with the disease to take it into your own hands, because that's the only way you're going to get something done. So the insurance side of it was very interesting. I'm on Medicare. We have Medicare contractors around the country that they're the ones that actually do the administration of deciding what drugs get done and not. So since I was the first one, I was going to go ahead and if I had to mortgage my house, I was going to take this medication. I never got a bill from. You get two bills. The charge to giving the infusion is about $240. Okay. The charge for the medications is thousands of dollars. So I wasn't getting a bill. Finally, I called Medicare up one time and said, we just want to check my balance to make sure I don't owe you some money. And they said, no, everything looks fine. You don't have a balance. And I said, okay, thank you very much. And I hung up the phone and I never called them back. So in a way, I sort of slipped through the cracks. My insurance did cover the actual infusion. I was on Aduhelm for 36 months. After that, they stopped Aduhelm because the uptake was too slow and they were on to another drug. They did do a nice job, though, of letting it continue for another 11 months before they stopped it. And they said they would pay for the drug. So I thought that was a nice offer from them. After that, then I switched I had to wait 6 months because, again, the hospitals didn't want to treat me onto Leqembi. On that, that was just through my own, advocacy, that I was on a maintenance dose. I was one of the first people in the United States, still am, to be on a maintenance dose. So we do not know how long I'm going to be on that maintenance dose because this is a new frontier. The thing that's really cool is beta amyloid plaque builds up in your brain. And then after the plaque forms, as you know, these tau tangles come out. I'm not so sure about your genetic situation if it's the same. So I'm just speaking about my own situation with the plaque and the tangles. There's a scintilloid score that they measure your plaque with. It goes from 0 to 100. Anything over 40 is bad. My scintilloid score when I started out was 70. Today, it's 3.6. All of the pathological amyloid has been removed from my brain.
That's worth celebrating.
Yeah, that's what's celebrating.
Yeah.
Yeah. So have I been cured? I don't know. I don't like the word cure. We don't have a cure for cancer. We don't have a cure for AIDS. We don't have a cure for a viral disease, a cold, okay? But we do have some really, really darn good treatments out there. So let's focus on good treatments and kind of realize this might be a chronic disease for which will always have to be treated, okay? So that was my other big issue was that when this new drug came out, the first headline says, a new drug has been developed. It's not a cure. It's not a cure. It's not a cure. I was like, yeah, but it's a new drug. We're waiting 20 years for. Can we have a little bit of hope here, a little bit of enthusiasm? I still have impairments, and I probably always will. I have some word finding issues. I have some short term memory issues. Those are probably my two biggest things. I get started talking, and I kind of talk myself into a corner and kind of forget how to get back to where I was. But I tell people, if that's what I'm stuck with, I'm so happy. I'm so blessed. If all I have trouble with is word finding and can't find my phone, this could be so much worse. There's so many other diseases out there that affects every minute of your life. If I stutter and I stammer and I forget things, if that's what I'm left with, I'm blessed. I'll take it. I don't know if that's where I'm going to wind up, but so far so good. My IQ, as measured in these tests, has gone up 2 points over 6 years, which is statistically insignificant. Unless it's your brain, then it's a pretty big deal.
That's a good segue into some questions from the community. I think Aaron's been taking a look at those. So let's see what we have.
Mike, thank you for all the inspiration. One of the questions that came through on chat was around the amyloid measurement. So, throughout
Yes.
both of your treatment periods, were you getting amyloid measurements as a part of your treatment program?
Yes and no. They said I was a one-man research study because I demanded to get PET scans more than they wanted. So I was following my process through the PET scans. I was getting better. They don't like to take too many. Insurance doesn't cover it. I was fortunate enough to pay for it on my own because I wanted to know. I mean, I want to know what my Alzheimer's number is. I know what my cholesterol number is. I know what my blood pressure number is. We need to get to having our Alzheimer's number. And one of those is the Centiloid score. They don't do it very regularly because it takes a special engineering measurement, believe it or not. If you ask them if they have the right staff, this won't be done everywhere. That's how I was followed by my scans and my Centiloid score and all these cognitive exams I was taking. And I can talk about the fallacy of those cognitive exams too, if you want to. But they're very, very inaccurate and very not sensitive. But I was pretty stable on those. It was very interesting. When I took my first cog exam, I had my neuropsychologist spend an hour and a half with me, and she showed me areas that I was significantly impaired on. And then an area that was linked, I would be very superior on. And then another area that I was very superior on, I would be in a related area, I would be impaired. And that was unusual because those areas you're kind of linked on. So, but I have found that fascinating.
So, folks are curious about your maintenance program. Like,
Yes,
what is the amount, the frequency? Are you
yes,
doing these injections yourself? How are they delivered?
yes. Yes. Okay. We're charting new territory on the maintenance dosage. Okay. We don't know how long I'll be on them. My physician, who was head of banner, says as long as it's doing no harm, he didn't see a reason for me to stop because we do not know what happens after the plaque is removed from our brain and we're removed from the treatment therapies, the disease modifying treatments. We don't know what happens after that. So as long as it's keeping the plaque down and hopefully the tau, then you can go on. That's one neurologist opinion. It started out as a once a month dosage. Okay. The standard dosage when you're starting on Leqembi is twice a month infusions for 18 months. But since I already had my 36 infusions, and that was another big issue because my first infusions were on one drug, then I was switching to another drug. So I had to go to an infusion, and those infusions were quite longer. The whole process took about 4 hours. But as soon as the iPin came out, I badgered him and badgered him and badgered him, and I got on the uh, pin. It's called the iClick pin, where I self-inject at home now, and I've done this now for 2 months, and it's great. It's game changing. It's a simple pin. You just pop it on your leg and it pops out. It takes all of 10 seconds and it stings, big deal. And you're done. And I do it weekly. The nice thing is it gets delivered to my house. I get a 1 month supply. So I don't have to worry about planning my whole life around going to Phoenix for 2 days. And it's so simple. And it is going to be a huge game changer because one of the big issues in this disease is people getting access to treatment. If you live in Timbuktu, you're not going to be able to get this. But now, if you can get the proper early detection and diagnosis and get some treatment, they can send it to your home. Walgreens pharmacy handles it for me. And Walgreens sends me a note every month. Do I want my next delivery? And I say yes. And it shows up at my house miraculously the next day. But because I'm involved in a lot of research and I sponsor a biomarker laboratory, within the next 2 years, we're going to be taking a pill. Okay. It's going to be an oral pill. And that's going to be another huge game changer. Yeah. What it's going to look like in 2 or 3 years is you're going to go to your doctor and you're going to take a test on an iPad. Okay. It's not going to be the pen and paper test. And this iPad within 12 minutes is going to deliver 1,000 data points. And it's just as accurate as a spinal tap or a beta amyloid PET scan. And then he'll say, well, why don't we get a PET scan just to make sure? And then after that, he's going to write you a prescription for a pill. that's where this is going, and it's going to go there quicker than we think, so there's a lot of hope out there.
Oh, that's wonderful.
Yeah.
So, one question that we got was around how frequently you need to get MRIs now to check for brain
Yes.
and swelling.
Yeah, there is a protocol, and we don't have enough neurologists or geriatricians to do this treatment, so it's going to wind up in the hands of the general practitioner, and they're kind of stymied by the protocol. My protocol when I first took it, I had an MRI before treatment. I had an MRI, I think, 3 months, 6 months, and like 9 months or 12 months. So they watched me quite carefully. Once again, I have both APOE4 genes, which makes my brain more susceptible to brain damage or brain side effects. But that was sort of the standard then. And I felt fine with that. Generally, the side effects of brain swelling and microhemorrhages, I never experienced. But that's what they're looking for. So that was the protocol for them.
I see. And one of the questions that we got swings back to the emotional side of things. Can you talk more about what helped you the most to move through that shock and grief and sadness around your diagnosis? Because the diagnosis is both, hey, this is a terminal illness, but also not immediately. And in your case, maybe not ever. So it's a complicated diagnosis to process emotionally, and it could mean a short thing and it could mean a long thing. What helped you move through the shock and the sadness and grief?
My family being supportive, my stubborn nature of I'm going to beat this disease. Don't know how, but I'm going to do it. I love life, and I want to enjoy life. And I think just feeling that I'm going to do everything I can. I'm going to throw everything I can at it, and learn about it, research about it, get on the phone. I've been on the phone for hours and hours and hours trying to get appointments and talking to people, and trying to get. But that's what you got to do. But you got to stick up for yourself, man. Okay, hope, not false hope, not fake hope, but real hope. And that, I mean, we're at the beginning of a new era of Alzheimer's treatment. We finally have Alzheimer's treatment. We're sort of, I think, at the beginning of where chemotherapy was, when chemotherapy started. In the end, this isn't just going to be a one thing fits all. We're going to find out that inflammation has a big deal to do with it. So we're going to find out how to fight inflammation. And then we're going to find out what the tau tangles are really doing. And we're going to find out how to wipe out the tau tangles. The neurologist explained to me the plaque in our brain is the kindling and the tau tangles are the spark. There's a fire. So, but there's hope out there. I mean, there's real hope. My message to people is go ahead, get early detection. I don't like to use the word diagnosis. No one wants to get a diagnosis, right? But early detection is much more palatable. Like, yes. So get early detection. Okay. Get out there. You can have this disease. You can walk, talk, chew gum, and have Alzheimer's disease all at the same time. Just get out there and do it and go on and live your life. Be the person you want to be. And don't let this, disease just kind of define you. It may be terminal, it may not. We don't know what's going to be around the corner, but, just get after it.
How did you approach telling others? You made the decision, your daughter
Mhm.
influenced that you
Yeah.
should overcome the stigma.
Yeah.
Who, what, and when did you tell them and how did they react?
When I got the diagnosis, they were going somewhere out of town, but we all got back together and I told them because, they were around for my grandparents. And I just told them that I was just going to beat this disease. It was all there was to it. That's my single focus is to beat this disease. Now I have another focus to help other people get early detection. I'm passionate about that, but I'm going to beat it. It was terrible. It was a terrible weekend. I cried a lot. It was kind of devastating to hear that diagnosis is pretty hard, even though I was expecting it. I told a few friends, I wanted to go public, but I was in Colorado at that time and working with the Alzheimer's Association there. I said, well, I'll go public, but I just want to go public in Denver. I don't want to go public in Des Moines. And he kind of laughed because we were going to do something on the internet. He said, Mike, you go public on the internet, you're going public. Well, big deal. And I've been on the front newspaper of our local newspaper multiple times. I've spoken to large groups here in town. So Anybody who knows me knows. I do admit, though, the one advice I got from the gentleman who had been diagnosed a few years before me was, don't be too hard on yourself. I kind of didn't understand it. He said, don't be too hard on yourself. And now I get it because I'm forgetful on an hourly basis. And once you get this disease, as you all may know, you kind of become hyper aware, but you got to just be easy on yourself. I think frustration is the one emotion that I have on a daily basis. I just got to tell myself, calm down, just give yourself a second. Oh, just don't be too hard on yourself, you know? Yeah, that was a good piece of advice. So I just saw a question. If you didn't get your similar, how do you know the infusions were working? That's a very, very good question. And that's where we have to improve upon our ability to assess our cognitive skills. And I'm involved with a company who's actually doing that with the pad. Right now, these pen and paper tests that we take were developed 30 years ago, and they're not very sensitive. Sensitive means how closely can you tell? Is your cholesterol 110 or 120? Right now, for Alzheimer's, we have mild, medium, and high. That's about it. You know, this new development, which is coming out, and it's a big deal now. They're always talking about biomarkers, and now they're talking about digital biomarkers. My wife is a wonderful person, and she will tell you there's hardly anything wrong with me. There's nothing where somebody's else spouse might be, geez, he can't remember his name and say in his life. So those are subjective things. You know, one of you've all taken the test. You one thing is, you have trouble balancing your checkbook. And I go, no. I open up my computer and I go to Wells Fargo and I push a button and it tells me the balance in my checkbook. I don't balance. I haven't balanced my checkbook. Who's Queen Victoria? I don't know. Probably some princess or queen over in England. I mean, this is what we're basing our cognitive skills on. And some of the boxes, you could be really bad in one of the boxes, okay, that affects your lifestyle, and be okay in the others. And they'll say, well, he's fine, you know. So those tests are so inaccurate and so way behind the science. The brain science of treatment is so far ahead of measuring our brain health, you know, but that's catching up, and that's catching up pretty soon. So pretty soon you'll be able to go once a month and do your score on your laptop or a pad and see, hey, I'm holding still, or I'm going downhill, or I'm getting better. And that's important to me. I really want to know what my Alzheimer's score is because I'm a poor judge. I don't know if I'm better remembering something that I was 6, 7, 8 months ago. I feel it's the same, but it's so slow. We don't really can't be accurate. Am I better this month than last month? I don't know. I feel I'm okay, but you know, so to get accuracy in that. So there's so much that's going on in this field that's so exciting.
That's super cool. And this one didn't come through the chat, but we did talk about in the invitation your initiative uh, to change the D word. Can you
Yeah.
tell us a
Yeah.
little bit about your
Yeah.
organization?
Yeah, I started a nonprofit 3 years ago called the Initiative to Change the D Word. The D word mean dementia. I think it's a pejorative, insulting term. It was first came into being in the 10th century. It became a medical diagnosis in 1797, and 223 years later, we're still using the word dementia. I didn't like the word, so I commissioned a 1,000 person study survey over the United States, people 65 years in age and older, geographically and ethnically corrected. And it answered some questions for me. I thought, is it just me being overly sensitive? The first question was, is there a stigma associated with the usage of the word dementia? 7 out of 10 of the white population, 8 out of 10 of the non-white population said yes. The other thing that was the base case, because of that stigma caused by the use of the word dementia, 7 out of 10 white population, 8 out of 10 said it delayed their seeking a diagnosis. So that's the proof statement. Because right now, all the drugs are meant for mild cognitive impairment, early stages. If you get to moderate stage, I'm sorry, really, really sorry, but there's no treatment for you. That's why this disease is so important. And I don't know about your disease in particular, but so important to detect at the earliest stage possible. That's why I'm outraged by when neurologists say, well, they're fine. You know, if they start showing symptoms, come back. Well, when they show symptoms, guys, it's maybe too late. And that's why we have to get rid of the word dementia. There's 19 synonyms in Webster's dictionary. Okay. If you go to notdemented.com, we have a whole language guide of what terms to use. Everyone says, well, what's the word? I come to conclusion that there is no single word. The most preferred word in our survey was cognitive impairment. After that was mild and major neurodegenerative disease. After that was Alzheimer's. And after that, at the very bottom, not getting any votes, was dementia. So it's not the preferred term. So the University of Wisconsin uses words like thinking and memory issues. That's how they phrase it. At Banner Alzheimer's Institute, instead of dementia, they use debilitating cognitive impairment. Okay. The American Alzheimer's Association can change their ADRD, Alzheimer's disease and related dementias, to Alzheimer's disease and related disorders, related diseases. We're working on them with that. You know, that would be the kill, because we have to get people in early to get detected. You know, I tell people, what disease is treated better in its middle to end stages than at the beginning stages? Right? You don't say, "Oh, we'll wait around to see if this cancer spreads and then we're going to do something." And that, unfortunately, is sort of the attitude towards Alzheimer's. Dr. Alzheimer, Alois Alzheimer's, never used the word dementia. After he died, a colleague of his wrote a paper and used the word. He used words like cognitive impairment, believe it or not, way, way back when. It's very interesting. Someone said, a really respected person said, well, it really doesn't bother me. And I said, well, it bothers me. And I'm a patient. Some people are fine with it, and that's fine. This is my little crusade. And if you're fine with it, that's fine. You're still a good person, but just don't use the word. So
It's really wonderful to hear you talk so openly about everything. And thank you for taking time to answer all the questions that we had come from the community.
I will tell you one thing to sort of wrap this up that was very touching to me and very interesting. As I spoke yesterday, or the day before yesterday, to 425 people at the Wisconsin Alzheimer's Association annual meeting. And the Alzheimer's Association gives out flowers. There is, I don't know if you're familiar with the flower ceremony, but there's a flower for if you have the disease, I think it's a blue flower. And if you're a caretaker or a care partner, I think it's an orange flower. And if you're an advocate, it's a green flower. And they have a white flower for someone who survived the disease. They, for the very first time, awarded me as a survivor, potential survivor, a white flower. I think I'm the first person to get a white flower. So that was a very emotional moment for me and the audience to have someone get a white flower.
Absolutely something to hope for and very inspirational to all of us.
I just have so much empathy for all of us. It's a bad disease, but we got to have hope. We got to have hope, and we can't give up. And just live your life and go for it, and be your best advocate, and just enjoy yourself and enjoy your life, and embrace gratitude. So
Absolutely. Well, thank you so much again, Mike. It's been really wonderful talking with you, and we're so grateful for your time and all of the insights that you shared with us, as well as all the education around the treatment.